This is that important. This is at the beginning of the problem of homelessness. If you want to be a part of this and you want to help the drug problem, you want to help the homelessness problem, this is how you do it. Hi, this is Jesse. So today I'm here at Obsidian Mental Health with Chrissy. Want to go ahead and tell us like what services you provide to the community, and I guess just kind of go from there?
Yeah, so I'm a psychiatric mental health nurse practitioner. I've been around in the Valley for just over a year. My previous clinic closed rather abruptly, so I'm trying to put together this new clinic to keep my clients up with their care and their medications. And I see a lot of people with substance use disorders. We do an MAT program with Suboxone and Subutex. I do ADHD treatments. I do treatment for anxiety, depression, mood disorders like bipolar and schizophrenia. And we're just trying to keep everybody on their medications, keep them stable, keep them out of jail, keep them out of hospitals, and
Right,
just
if they have
being
plans.
successful in the community.
What are your credentials?
So I am a board certified psychiatric mental health nurse practitioner.
Okay.
So,
And your husband that works with you?
he has a bachelor's in psychology, and he is my office manager.
And you're able to prescribe and maintain medications for
Yes.
people?
Yes.
So that's hugely important in this area. Let's talk about more like what's happening with your guys' business. When you're able to accept funds, like say from Medicaid and stuff like that, there's a certain time period or a schedule that you have to follow. And because the previous place where you worked, where you were employed, shut down so abruptly without warning, you weren't able to start the process quick enough, basically,
Right.
within a 45. Do you want to explain a little bit of that, how that goes?
Yeah, so originally we thought because I was credentialed with these insurances and would just need new contracts for a new location, that it wouldn't take as long. I was told it could be as fast as 10 to 15 days with Medicaid. But we had some clerical errors that took them a long time to fix on our contract, and it's just been a very difficult, time-consuming process. They're telling us now it could be up to 45 days additional from what we've already waited, and that started last week, that 45 days.
That 45 days. From the beginning of when you applied, it starts over every time.
That's what they're telling us, yes.
Okay, and then now what comes into play now is there's a time schedule or a time limit from when you can collect funds for payments for like Medicaid and stuff like that, correct? This is 60 days?
Yes, they allow us to go 60 days back from the finalizing it. So every day that goes by without it, we're having visits that we're now not going to be able to get reimbursed for.
From the last month.
So now got that first week has dropped off, and
So
every
you've
day
already
that goes
lost
by,
the first week of bills that you've sent out, or of
Yes.
receipts. You've exhausted all help in, say, staying or deferring this time.
Yeah, we have reached out to get as much as we can from friends and family to help support, because they're very supportive of this endeavor as well. And we have personally sold off thousands of dollars of photography equipment. My husband is a photographer, now a photographer without gear.
So
We
you've
just-
personally invested
Yes.
a lot and given up a lot to take
Yeah,
care
it was
of and
about
to keep
10
things
years
afloat.
of accumulated photography equipment, and now it's all gone.
Now it's gone.
I don't want there to be, almost 200 people all of a sudden without a provider when there's already such a significant burden and weight on the system that's already here.
Right. And those that know right now, like you all know, like we need somebody to help people stay on their meds. Like this valley.
Yeah, because it is a huge impact for the community. If they can't get their prescriptions, they're going to go back to old habits. They're
Yep.
going to get back in trouble.
Yep.
And we don't want that to happen at all. And it's bad for them, it's bad for the community. It's just,
Bad.
I don't want that to happen.
Well, I really appreciate you. I'm really thankful that you're giving up so much.
Yeah.
You look. Are you okay?
I am.
You look like you're
It's
about to
just-
cry a
I'm
little.
very passionate about this. This is something that just means a lot to me. I've watched so many friends and family go through their own struggles and their own losses and their own issues. And I just want to stop that from happening to other people.
This is personal.
It really is. And if I could buy groceries with gratitude, I would, but I can't.
Right.
And I have to take care of my family too.
So this is Zach, and he's Christy's husband. He's deeply involved in Obsidian as well. So I kind of wanted to talk more about the immediate needs of Obsidian Mental Health. What's the business's immediate needs right now?
Basically, funding and support from the community. The biggest hurdle that we've had, as Christine said earlier, was just the insurance process. It's been such a delay. It's been delayed and delayed and delayed, and put in our personal assets. We've sold essentially everything that we own of value to keep this up and running. We just need that extra little push, I guess, for the next maybe month or so. We've been running on fumes since September, the end of September, early October.
You're actively doing this.
Yeah, we are full-time, full caseload of patients right now.
200 plus patients.
200 in the system. 200. We are actively seeing 60 or 70 right now. And then we get patients added in almost daily. Sometimes multiple calls from Riverside Recovery, from Chaz Health. Once they find a patient that fits with how we do things, then they send them over, and we've had a lot of success. And the biggest hurdle, again, is just bridging that gap until we can start getting reimbursed for insurance.
What would you say conservatively you would need support with for the next month or two?
I think minimums, I guess, probably 10,000, 15,000-ish. So that would pretty much put us at a net zero right now. That would allow us to keep open.
But you got 45 days minimum, or 38 more days minimum.
What we've found is that especially individuals with ADHD, a lot of times they will try to self-medicate because there's so much going on here. And what we found is that if we treat that with like Adderall or something like that, like where they would be going to meth on the street, they don't go seeking. And it's been an amazing turnaround for a lot of people.
I have to admit, sometimes people need meds.
Absolutely.
And self-medicating means, if you're depressed, you smoke weed. If you're needing ADHD meds, you get high on meth. There's different drugs for different ailments, I guess, different mental illnesses. And that's what happens when you don't get your meds. You go self-medicate.
There is a major problem with people self-medicating.
Oh yeah, and there's a major problem with not being able to get meds.
Right.
So that's a huge thing here.
So there's definitely a correlation there, not a causation. So, so that's our goal, is to try to help as many people as we can, help them live the best life that they can possibly live.
Right.
Get off the streets. Get off the street drugs. Get on a regular process and plan, and the sky's the limit for them. There's so many creative, cool, awesome people out there.
That might be one of the biggest starts to stopping homelessness, is managing meds. I mean, straight up. It's really big and really important that you guys are here in this valley helping people. So what I want to do then is ask the community this. This is important. This is huge. We want to talk about ending homelessness. We want to talk about the drug problems, and we want to talk about all that stuff. It's hard to find where those things begin. Where in our society and in the valley here does it begin? And this is one of those spots. We have a place now, currently, you guys, Obsidian Mental Health, that can facilitate and help people be normal, I guess you could say, get on their medication that they need to be on, have a level thought process. It's when they start self-medicating, like he said, they go to drugs and then they start losing everything. They go to jail, they lose everything, they lose their place to live. Then we got a homeless person, wandering the streets, and they're going to continue self-medicating and continue doing it. This is that important. This is at the beginning of the problem of homelessness. So what I would ask is, anybody in this community, I'm putting this out there right now, there's more millionaires in our area than most of the Western United States per state capita, per our area. Anybody out there, if you want to be a part of this, if you want to be a key component into helping solve the drug problem, homelessness problem, this is a good place to start. Like, they need somebody to carry them for the next month, and something like this can be done. I ask anybody out there, give them a chance, invest into them, help them out, because you're helping your community out. The place where you live, where your kids, if you have any, your grandchildren, here, the LC Valley, Lewiston and Clarkston, and surrounding areas. If you want to help, this is the place. This is the time. Every single penny, 100% that you give, will go to them. Will go to help this organization help the community. So like I said, if you want to be a part of this and you want to help the drug problem, you want to help the homelessness problem, this is how you do it. Thank you, LC Valley.